You know the drill. You sit down in the chair, they wrap that tight band around your arm, and then comes the quick little prick of a needle. It feels so routine, right? Just a normal part of any checkup. But what if I told you there's so much more going on? That this simple procedure is actually this incredible mix of art and science where one tiny slip up can have some pretty huge consequences. Today, we're going to pull back the curtain on the humble blood draw. So, what could actually go wrong? I mean, it seems so straightforward. But here's the thing, a whole lot can. An improper blood draw isn't just about the annoyance of getting poked twice. No, it can seriously affect your health. It can lead to the wrong diagnosis or maybe a treatment plan that just doesn't work. Really, there are only two paths this can take. When it's done right, everything's smooth. You get accurate results, your doctor knows what to do, and you get the right treatment on time. But if it's done wrong, well, that's a whole different story. It kicks off this domino effect of problems. The lab might reject the sample, your diagnosis gets delayed, and you're right back in that chair, having to do the whole thing all over again. So, in this explainer, we're going to break it all down. First, we'll talk about why this is such a high-stakes procedure. Then, we'll go through the all-important pre-draw checklist. After that, we'll get into the technique of mapping the perfect vein, look at the anatomical red flags to avoid, and wrap it all up by seeing why precision is everything when it comes to patient safety. Okay, let's start with the big picture. Why do we call this a high-stakes procedure? Well, it's pretty simple. A quality blood sample is the absolute foundation of quality medical care. So what even is a blood specimen? It's not just some blood in a tube. The key word in this definition is carefully. This is a sample that has to be collected with total precision. Also, doctors can get a perfectly clear picture of what's happening inside your body. And that little sample, it does three huge jobs. It helps with the initial diagnosis to figure out what's wrong. It's used for monitoring to track how a condition is progressing. And it's crucial for evaluation to see if a treatment is actually working. If that first sample is bad, the entire plan for a patient's care can just fall apart. Now that we get the stakes, let's talk about the prep work. This is the pre-draw checklist. You can think of it like a pilot's pre-flight check. It's absolutely essential to get right long before the needle even makes an appearance. These steps might look like basic paperwork, but they are non-negotiable safety nets. First, you verify the doctor's order. You have to make sure you're doing the right test for the right person. Second, you confirm the patient's identity with at least two identifiers, like their name and birthday, to avoid any mix-ups. Third, you check on fasting. Why? Because something as simple as your morning cup of coffee could totally skew the results for cholesterol or glucose tests. And finally, you just explain what's about to happen. A little communication goes a long way in calming nerves and making the whole thing go smoother. All right, with the prep work done, it's time to get technical. This is where the real skill, the real art comes in. It's all about mapping the ideal vein, kind of like a navigator charting the safest and most direct course through the arm's anatomy. And believe it or not, there's a definite ranking system for veins. The number one choice, the gold standard, is the median cubital vein. It's that one right in the crook of your elbow. It's nice and big, and it's well anchored, which means it doesn't wiggle around. The second choice is the cephalic vein, over on the thumb side of your arm. It's easy to see, but it can be a little tricky because it sometimes likes to roll away from the needle. And the third choice, kind of the last resort, is the basilic vein. You have to be super careful with this one because it's nestled right up against major nerves and arteries. Okay, so just as important as knowing where to go is knowing where not to go. And that brings us to what we can call anatomy's red flags. These are the absolute no-go zones for any blood draw. And these are hard and fast rules, not just gentle suggestions. For instance, you never draw from a swollen or edematous limb because the extra fluid will dilute the sample and mess up the results. You avoid infected or burned areas because of the risk of contamination. Drawing from an arm with an IV? Big no-no. You'll just end up drawing the IV fluid, not the patient's actual blood. And areas near fistulas or on the same side as a mastectomy are completely off limits to prevent causing serious harm to the patient. So when you look at all of this, from the administrative checks to the choice of vein to the no-go zones, what's the one thing that ties it all together? It really boils down to this one simple, crucial idea: precision equals patient safety. That's the big takeaway here. This quote from our source material really says it all. The quality and integrity of blood specimens directly impact patient care outcomes. See, it's not just about getting blood, it's a direct line to a person's health.
Every single detail, no matter how small it seems, makes a massive difference.
So the next time you find yourself in that chair with your sleeve rolled up, I want you to think about what's really happening. Is it just a blood draw? Or is it maybe the first and most critical step toward getting the right diagnosis and getting on the path to better health? I think the science is pretty clear on that one. It's definitely the latter.